Hello again. So here is the first question that I want to answer. How do you know that someone is good at patient advocacy, integrative health practices, giving you options? How do you know they're qualified to do this? So first, I recommend that somebody that has extensive knowledge in this particular area has some legal training. So I am a legal nurse consultant, but I also am versed in privacy and do a lot of reading and research in those areas, legally and for privacy protection, because all information that you share is private and confidential with healthcare professionals. The other thing that is very useful is to have someone that has a mostly nursing background. Most of the advocates are either nurses or lawyers, believe it or not, but it's good to have someone that has a healthcare background, that has extensive healthcare background, not just at the bedside, but in management and perhaps in education. Well, I have all three. So that you get a good, solid understanding of what are the best practice guidelines, what are the policies and procedures, protocols, what are the laws that protect patients, what are the ethical and moral considerations, as well as what are the guidelines and practices that we practice hands-on. What does that mean? What is a patient ratio, or like how many nurses should be on a unit? And a lot of people have different perceptions. And I found this out that people have a lot of misconceptions around, how many nurses, what is to be done, what is not to be done, and what are some of the ways that these things are applied in the clinical setting. So this is where you want someone that has that kind of knowledge. And it doesn't always have to be me. I mean, you can certainly hire anyone in any country, but make sure that they do have those type of understandings so that they can give you the best possible offerings as far as choices and also complementary therapies, alternative works. Because one of the things I also found is that people do take a lot of other supplements, for example, and they take medications, and not all of them go together. So you want to be able to have a chat with somebody around, well, I'm taking these medications, I'm also taking these supplements. Do these go together or not? Because sometimes it doesn't. So you want to make sure that they can answer those questions, or whoever is working for you, they have access to that knowledge through their network or their employees or colleagues and so on. So really important, make sure that they have a good solid background in education, in hands-on work. And in my case, I worked at ICU for 20 years, and then I was in management for about, 5 years, no more than that. And I also did I was faculty, and I was teaching the information that nurses need and healthcare professionals need to apply that knowledge. So you want someone that understands how is the knowledge applied as well. And these are good markers to know. Of course, in the end, it is who you trust. Who do you believe in that they can do and they can deliver that which you are looking for? Sometimes we may say things that you don't like. There may be options that people want, but they are not an option in that particular case. And that then we can educate why that is and how that has come about, versus believing that something that, let's say, a neighbor mentioned or something was on the news is the case. This is really important. If you have a healthcare professional that is licensed or is licensed by a board or a college in Canada, or there are different regulating bodies, that they do have to abide by ethical rules, moral obligations, as well as standards. And those are always good markers that that person will give you the best possible answers and guidance to your questions in healthcare.